Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio. It's gorgeous outside. What a beautiful day. It actually looks and smells and feels like fall, particularly after all the heavy blow that we had yesterday. Hopefully all of you are in a good place and nothing happened to your property or to you. Anyway, I'm here at 888-630-9625. That's 888-630-WMAL. Love to talk to you. Any subject you have in mind. Perhaps you've had a problem, you've tried, you've applied, and you've come up with the same old, same old. Well, here's your solution. This is your answer man, so to speak, without drugs, without surgery. Let's see if we can put the fire out. 888-630-WMAL. Have several things I want to talk to you about and remind you of several things today, and we're going to talk about a double-edged sword of something that is a common beverage for many of you, and you really need to know a lot about it. I'm asked about it constantly, so you need to know what you're getting into. There's some benefits and there's some unfortunate side effects, and you need to know about that. And we're going to talk about X-ray exposure. We're going to talk about actually radiation, ionizing radiation, about 18 months later after the Japanese meltdown at Fukushima, and I'll get that right before the program's over. But anyway, let's talk about that, and I think there's things that you need to be aware of, because a year ago, I think it was March, it was the meltdown because of the tsunami and then the earthquake and everything that took place that caused that nuclear site to implode. And we need to talk about the overall exposures and what happened and what's still happening and the effect that it's had on you. Yes, us here in North America, because of the different winds and high-velocity implementation of these devastating X-rays, if you will, ionizing radiations that have affected all of us, even the food that you eat. And we're going to talk about that a little bit. But before we do that, I want to remind you, coming up October the 20th, Ageless Health 2012. How to Live Well in a Stressful World. That's our keynote event this year. And I encourage you, we're almost at capacity, so don't wait too much longer. Don't forget, Dr. Evan Mladenoff from Kansas City, doc for the Kansas City Chiefs for 12 years, a very well-known author, stressed out, headed for burnout, is going to be our guest. He's going to be talking to you about the emotional side of healing. You know, that's an important piece. We talk about the triad all the time, structural, chemical, emotional, and we, often give, I think, just lip service to that emotional piece. But it's important. It's one of the most impactful things that we kind of take a back seat to. See, he's going to talk to you about it. He's going to really tell you what happens when the brain is not engaged with the rest of the body, or when it is engaged, how you can turn almost anything around. But Ageless Health 2012, one of the most amazing days that you will ever commit yourself to. You will walk away with the capacity to change your life the very next day, truly the very next day. You'll walk away and hear some brilliant speakers and imbue that information to a place where it's usable, and you get to take everything home. You're going to be registered for $1,000 worth of gifts to you, healthcare gifts. Each one of you will be entered. And there's some other gifts, there's other vendors, there's all kinds of things. This is the day that you're going to learn how to exercise. While you're registering, you're going to be shown how to do core training type of exercise anywhere you are, even when you're sitting. And then you're going to watch the Chinese Martial Arts Institute in Merrifield present a wonderful demonstration on Tai Chi Guan. I do it all the time. I am a student of Tai Chi, and I'm telling you, this is an amazing, amazing thing that you should all incorporate into your lifestyles, because it doesn't take a lot, but it makes huge, huge differences. All of that for you at Ageless Health 2012. Go to our website at rosellecare.com. That's ROSELLECARE.com, and register. By registering online, you will get a discount just because we don't have to do the paperwork. And you also get a discount if you register 2 people at one time. So go online and get that done, because as I said, we're coming up to the end. Only about 6 more weeks, and we will have Ageless Health kicked off to a place where it's going to be very usable to you. Also want to remind you that November the 29th, big day for us, Ageless Health, the movie, is going to be premiering in Washington on PBS. Keep that date. Put it aside, and please watch it. We're going to put a trailer up so you can view the trailer probably within the next week, maybe 2 weeks. You'll be able to see that, but more importantly, watch it. It's going to be amazing. We're going to talk about radiation exposure a little bit, and you can give us a call at 888-630-9625. But there's things that you need to know. As we said, 18 months ago, it happened. The tsunami hit and devastated Japan. And I've talked about it many times in a lot of the presentations I've done outside the office and with students and with doctors. But the concern is the overall exposure that has taken place. And there's been many papers written. There's been much study on it. And, there's one that was fascinating. It's called Japan's Toku earthquake 1 year afterward. And this came out last spring, almost to the date of its anniversary. Well, as I went through and I studied the Fukushima, meltdown, it was very obvious that this was not just a small disaster. It compares with the limits that are set by all governments, and they exceed those limits by 20 times. So if the body total radiation exposure can handle X, we're looking at 20 times X as the end product exposure to people because of that. And, the thing of it is just under 60% of 9,747 people surveyed had been exposed to less than the amount that we talked about over a 4-month period. But what they came back and found was that, in fact, it wasn't just that exposure, it was 20 times that exposure. And those are the things that they don't tell you. There was a report on Moss Nutrition report going back in April and basically said that the limit on whole body exposure for radiation workers for 1 year is only about 50,000 microsieverts, and that's how they measure this thing. But what we're talking about here is that an initial exposure of 23,000 millisieverts of radiation were recorded in a short period of time. Now, let me give you the equivalence, okay? 1 year's worth of exposure to natural radiation, that's from soil, that's from sunlight, cosmic radiation, other kind of things that are coming after you, are 3,000 microsieverts. One chest x-ray is 100 microsieverts, and we worry about the accumulation of chest x-rays. One dental x-ray is 40 to 150 microsieverts. One mammogram, which I don't like, and I don't like them, is 700 microsieverts. A CAT scan, which everybody's up in arms to the stomach area, to the abdomen, is 8,000 microsieverts. Full body, when you go to the airport and you get in the scanners, is 0.0148 microsieverts. Now, when you fly as much as I do, that adds up over a period of time, and pretty soon you have these things accumulate. Now remember, all these exposures accumulate. They just don't get in your body and leave. They add up over a period of months and days and years, and there's only a depletion of it, a small depletion, as it is compared to overall exposure. So then, if you smoke a pack of cigarettes a day for 1 year, then guess what you get? 80,000 microsieverts. So you're killing yourself. And we know that when you have an exposure like these people were exposed to in Japan, that this just adds to the pattern. Now, here's the deal. You didn't have to be there. You didn't have to be there. It accumulates in the atmosphere, and the atmosphere, because of rain and because of other types of things, gets into the ground and the water sources and so forth. So you can see that radiation exposure to individuals in or close to the reactor area was really very significant, particularly as it accumulates over time, and the genetic exposure is quantifiable. We've talked about this in several shows before, but I wanted to get very, very specific with you today because I think it's important. We're seeing more effects. We're seeing effects in our food. Potassium iodide is the only compound that seems to be effective in counteracting the effects of this type of radiation exposure. And I think you need to know about that. And whether you have ongoing exposures because of x-rays or because of mammograms, because of going through scanners at the airport, or you smoker and so forth, you need to be taking iodine, but particularly potassium iodide. They're not all the same. They're not created equally. So here's the deal. The biggest problem that we have is in soft tissue with x-ray exposure. It has to do with the thyroid. It has to do with the breast tissue. It has to do with the areas of reproduction. And potassium iodide seems to have an effect. Estimation of thyroid doses and health risks resulting from the intake of radioactive iodine in this type of situation, whether it's in your food and your drinking water, by the people in Japan, in Tokyo, was far above the expectations of the meltdown. So the main purpose of all the studies that are out there were simply the following, is to demonstrate the intake of iodine, radioactive iodine, in drinking water, in foods and milk and dairy products and vegetables and all the exposures that we have, and what the accumulated effect is over a period of time. So when you look at this, we realize that we have a problem. The problem is not insignificant. It's one that is not only significant from the initial meltdown, but is also significant in the fact that it hasn't gone away. We have these clouds of radioactive particles that are floating around and ultimately saturate into our foods, into our water supplies, into our skin tissue on an ongoing basis. So what do we need to know, and how do we fight this? What do we need to know about that? Well, we're going to cover that specifically. We're going to talk about antioxidants as radioprotective agents and the things that you can do to help yourself. We're going to talk about some other things, but first, I want to go to the phones. Carl, can I help you, sir?
Hey, how are you today?
I'm doing well, my friend. Thank you for calling.
Good. Hey, I just wanted to know, I've been diagnosed with Peyronie's disease, and was wondering if there's any way to reverse that. The medical doctors that I consulted with said that there's really nothing that can be done aside from surgical implants.
When were you diagnosed?
About a month ago.
Okay, and how did they do that?
Just by visual and palpitation.
Okay, so
around the base.
No, I understand. The biggest problem that we're dealing with Peyronie's disease is that from the medical point of view, the only way they handle any things to any of the reproductive organs, but particularly the penile shaft, is by surgery. And were you circumcised years ago or no?
Yes.
Okay, so it's really more.
Baby.
It's more common when guys aren't, but basically it has to do with the curvature, and it's a contracture, just like people get contractures in their hands. It's called a Dupuytren's contracture when it happens in the hand, but it has to do with the tendons and the tissues that form the curvature of the penile shaft. So how they handle that is that they go in and they cut it, and then they stretch it to elongate it, and so you don't have that constriction in that contracture. Is there another way to doing that? The only way that I'm aware of that has been attempted before is constant stretching and trying to open that up. Any contracture of any tendon or ligament tissue has to do with damage. And it can be a trauma that took place years ago. You could have fallen on something, and then it didn't show up until many years later. But it's basically a cord-like thickening that occurs, but often and most commonly you see it in the hands, or sometimes you see it in the feet. But the biggest problem that you're going to notice, unfortunately, is that a significant bend in the penile shaft, and it has to do, unfortunately, with scar tissue and hardening. And then also then it narrows the shaft itself, and it can cause pain and so forth and so on. So other than manual stretching and elongating of the tendinous structure, there's not a lot that can be done unless you work at it constantly, and I mean several times a day, stretching. Other than that, your end result is surgery. I wish I could be more helpful to you, but that's all I know about it.
Well, thank you very much, sir.
Carl, you're more than welcome. Thanks for calling. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm here at 888-630-9625, 888-630-WMAL. Love to talk to you. We're talking about radiation exposure, particularly the aftermath of what took place 18 months ago in Japan. It's not something that to be taken lightly. The accumulation of radiation is the problem. It doesn't go away very quickly. We talked about the amount of radiation of exposure could have been up to 50,000 microsieverts because of the exposure, and even more, some people are talking much higher levels than that. But the problem is that initial blast and then the accumulation, the plume of radiation that continues in the air that ultimately got into the water sources and food sources in North America, added that to the things that we're exposed to on a daily basis, from X-ray exposure to mammograms to just flying in airplanes from one area of the world to another. You know, I've told patients over and over again, I said, you get more X-ray flying from New York to Los Angeles, 30 to 40 microsieverts, than you do from a bone X-ray, which is very, very low level. But you add that, and if you fly a lot like I do, you're accumulating these X-ray exposures on a daily basis. The amount of X-ray exposure is not something to be taken lightly. It does cause damage. However, let's clear the playing field a little bit. The following facts are true when it comes to the studies that they've done with the people that had the exposure in Japan. The total and fatal risk of cancer, that's what we're calling cancer incidents and the death thereof, from the intake of the type of exposure that they had in Japan, were estimated for many to include naturally occurring radioactive exposures, environmental pollutions, diseases, and so forth. And it was significant that not in of itself was there damage, but the added accumulation and the constant exposure thereafter were the things that were disastrous. And what they can predict, what they don't know about, is what it's going to do genetically and how it's going to affect other generations to come. Well, there's things that we can do. We've already talked about potassium iodide. Seems to have an effect. Potassium iodide supplementation seems to negate the damage due to this type of radiation exposure. The short answer in all this is that it can hurt and it can be beneficial. There's studies that say that don't overdo it, and there's studies that say make sure that you're at least taking something. Adverse reactions to potassium iodide can be grouped into thyroid and non-thyroid effects. And if you get too much, you can also stimulate a goiter. If you don't have enough, you can stimulate a goiter. Hypothyroidism and hyperthyroidism, and then tissue damage and mucous membrane damages and genetic damages and what they call X-ray exposure sickness and so forth. And it goes on. So there's a gentle balance between the two that you have to be very, very careful of. But there's another piece of the puzzle that they don't talk about. And this is a subject that we can talk about actually probably for the next 4 or 5 hours, and we can debate it back and forth. But the studies are coming out, and they're quite significant. But there's one product, melatonin, which a lot of people don't talk about, but there's a significant paper that was released and talked about a radiobiological review on melatonin that it was called A Novel Protector, and the author was a guy by the name of Shirazi that you can look up, and just look up a radiobiological review on melatonin, A Novel Protector, and you'll find it. It's quite interesting, and it talks about how ionizing radiation adversely affects human physiology and biochemistry, and he goes into explaining the damage and the things that can take place. But he also, the key to this thing is that he found that melatonin at not even significant levels, at about 1 gram a day, acts as a very, very strong antioxidant, protecting the body from damage. Melatonin is an important antioxidant as an efficient neutralizer of these types of damaging, and we call them free radical damaging substances. And when melatonin interacts with the body, it becomes transmitted to a substance that kind of gets in and protects further degradation and deterioration, actually reverses a lot of this. We're going to get into a little bit more of this, and I'm just going to give you a list of the things that you should have on hand, really, to help yourself, to protect yourself, you and your family, in case anything happens, but particularly on a day-to-day basis. If you do the kind of flying and running around and exposures that I have, you need to have this as part of your armamentarium. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio, 888-630-9625, 888-630-WMAL. Love to talk to you on any subject you have in mind. We've been talking about radiation exposure 18 months after the Japanese meltdown. You notice I've been kind of steering away from, the word because I keep stumbling over it. But, the tsunami hit and Japan cooked and Fukushima. I think I said it right. I'm not sure. Fukushima. I apologize to everybody that's out there, but, my Italian tongue sometimes does not pronounce things properly. Nevertheless, 888-630-9625. We're going to get back into that just for a few minutes because I want to give you some things that you can do to protect yourself from radiation exposure, and then we're going to talk about some other interesting things. But in the meantime, Bob, how can I help you, sir?
Hi, Dr. Roselle. How are you?
Thank you. I am well. I'm very well. How about yourself?
Wish I could say the same thing. I have recently, in the last 7.5 months, lost a lot of weight, and about I guess 4 months ago now, my doctor diagnosed me with a case of prostatitis.
Okay.
Infected prostate. And he gave me a course of antibiotics, which seemed to help for a little while. Then the symptoms came back. I had another course of antibiotics, which seemed to help for a little while, and then the symptoms came back again. Since then, I've been trying some natural remedies because I really don't want to keep on taking the antibiotics. I've been trying colloidal silver and olive leaf extract, which will help a little bit, but not much.
The olive leaf extract will help, and there's not too many side effects that you have to worry about that, but the colloidal silver, be very careful. 10-day cycles maximum. You can end up with a permanent tinging of your skin if you take it way too long. So it's meant to be cycled. It's a good product. It's excellent. It works very well for bacterial infections and fungal infections and all kinds of things, but it's one that has to be very, very guarded. Now, let's talk about it a little bit. First of all, prostatitis is not necessarily a bacterial infection. It can be a primary bacterial or it can be secondary simply because of the breakdown of the immune function of the prostate. In a prostatitis, just taking the word apart, itis simply means inflammation. It does not mean infection by itself. It can mean infection, but not always. So you have to look at it as what's really causing it. The fact that you keep getting the problem back means one of a couple things. One, you're either getting reinfected in some way, either through intercourse and you're being, that sort of thing, or you're getting a secondary fungal infection that then predisposes you to a bacterial infection, so the overlay, or you can just have an acidic imbalance of the environment of the prostate and the bladder, ultimately leading to the reintroduction and infection of these different things. So it's not just a straight up, here, take this antibiotic and go away and everything will be cool. So you've got to find out what it is. But obviously it can give you everything from low back pain to very, very painful urination, fevers, and yada, yada, yada. So what do you do about it? The fact is that you've taken antibacterials and they have worked minimally, but the thing comes back again, tells me that, one, we either have reinfection or we're not getting to the cause. So what I would encourage you to do is a couple things that you can try on your own. First, you need to shift your diet very alkaline. I mean, if you've listened to the program, you've heard me say that 1,000 times. The reason why is because infection can't live in a alkaline state. It only lives in an acidic state. So what does that mean? Sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, anything that the body shifts into an acidic line. Now, you can get a list. You can go online, go acid alkaline foods. You can buy a copy of my book. It's all written out in there. But do that for a while. Lots and lots of water, a little bit of lemon. And I would get mandelamine. Mandelamine or mandelic acid also will work to help alkalinize the urinary tract and the prostate. Manos.
Can you spell that for me?
Mandelamine. Mandelic. Let's just do the mandelic acid. M-A-D-L-I-C. Mandelic acid. The other thing I'm going to give you is Manos. L like Louis dash Manos. M-A-N-O-S-E. And you want to take about 2,000 milligrams of L-Manos a day, minimum. And what that does, it stops the replication of the bacteria, so it won't grow. But in the meantime, if you have a fungal infection that is underlying this thing, anything like alcohol or dairy products, peanuts, peanut butter, anything that is fermented is going to cause it to be much, much worse. So that's how you start the process. The other thing that you would take is Golden Seal. Golden Seal is a shotgun. It's an antimicrobial. It works on a lot of different types of bacteria. And I would go, Herb Farm is a good product out there. I would take the maximum dosage about 3 times a day. I take it up to 4, probably in the initial 3-4 days. But if none of this works, within a week's time, and then you need to, if it starts getting better, you need to stay the course. And in addition to that, I would take a very, very strong probiotic, and you can get that at any of the health food stores. Have them give you the strongest potency that they have, and take it 3 times a day. Nothing I'm telling you is going to hurt you or have a side effect with anything else that you're doing, but it can be very significant in clearing this out. If that doesn't work in about 2.5, 3 weeks' time, where you really know that you're getting a hold of this thing and it's going away, give our office a call and come in either through our nutrition department or see one of our docs, and then they can take you the rest of the way. You know, it's interesting. The neurological system is so intimately affected with the prostate. The nerves from your low back, right at the belt line, that 5th disc area, that S1 nerve root, goes directly to the prostate and the penis and so forth. And if the neurological input isn't what it should be, then you're going to be predisposed to things like this. If you're not clearing completely from the urinary tract, meaning the bladder's overstretched, sometimes it'll predispose to this. The acupuncture circuits that cross over and control the prostate, bladder meridian as well as kidney meridian, have to be working well. So there's a whole matrix, but try the things that I told you to do, see if that works, and if it does, great, good for you. Keep on it. You're going to need to stay with it probably 6 weeks. If it doesn't work, if you don't see a noticeable difference within about 2 to 3 weeks, give us a call.
Okay, just one other quick thing. In the past 7 months or so, I've lost 80 pounds because I've changed my diet.
Okay.
Could that have anything to do with this reinfection? I've heard that you can release a lot of toxins and stuff in the system when you're losing a lot of weight.
The short answer is yes. How much water are you drinking?
I drink about 1 liter a day.
Okay, what's your body weight?
Right now it's 270 pounds. I was up to 350.
Okay, you need to go about a gallon of water a day.
Gallon, okay.
Okay, take your body weight, divide it by 2.2, and that's the number of ounces of water that you should be drinking every day.
Okay.
Okay, add a little lemon to it, and it'll help detoxify. So in your situation, the short answer is absolutely yes. That could be part of the predisposition that you're experiencing.
Okay, because it started, shortly, just a month or two after I had started losing all this weight.
Well, that tells you the answer then. You're dumping, you're detoxifying very rapidly, and your body's not able to handle it. It's trying to get out through the urinary tract, and your body's burning like crazy. So keep yourself extremely clean, and make sure that you're drinking enough water, and stay away from the things that I told you to stay away from.
Okay, and the that was L as in Lincoln, Manos, M-A-N-O-S?
That's correct, M-A-N-O-S-E. Okay? Bob, thank you for calling. I appreciate it. 888-630-9625. That's 888-630-WMAL. Love to talk to you. We were talking about radiation exposure, so let's sum it up. So what do you need to do? Well, iodine, particularly potassium iodide, is going to help you. Melatonin is another thing that you can take, but I wouldn't take it, much more than 1 milligram a day. And none of these things are carte blanche for all of us. Low levels of vitamin E, but very low levels of full complex, not these things where you're taking 1,000 or 400 milligrams, but something in the neighborhood of 100 units of vitamin E. All these things will help protect tissue. And the list goes on, but there's a couple things that all of us should have, and one is the melatonin, the other one is potassium iodide. Potassium iodide, what level? About 30 milligrams a day. That's ample to protect you. And most of you can take it unless you know that you're allergic to things like shellfish, and then you better do it in conjunction with a doc and his recommendation. Otherwise, you get yourself in a whole lot of trouble. So do that. And if you have any questions, you can always get a hold of us through rosellecare.com. That's ROSELLECARE.com. And by the way, follow us on Facebook and also Roselle Radio, and you'll see different blogs. You'll be able to catch up on these programs on a regular basis and find out about all the things that you can do to help yourself. I promised you I'd talk about a little controversial subject. It's called coffee. And you know what? There's a lot of articles going that are being published on coffee and the protective effects and the longevity effects and so forth. And you've always heard me say sugar sodas, coffee, teas, fast food, fried foods. And why do I say that? Why do I think coffee is such a bad deal when there's so many other people coming out that say drinking coffee may add years to your life and so forth, and decreases the risk of certain types of cancers and vascular disease and helps you keep your brain going, and the ongoing effects seem to be positive. Well, here's my feeling on coffee. if you can get organic Kona coffee, then you're at least at a place of neutral. If you drink regular coffee, it's very acidic. And then if you add cream and sugar to it, it becomes even more acidic. And you're shifting your body. Now, having said that, coffee has to be processed through phase 1 liver detoxification. And if you're already messed up, you're going to increase your inflammatory reactions and your body's going to hurt. If you suffer from gout, coffee is not your friend. It's going to make things even much worse. If you're trying to detoxify, the only coffee you should be drinking is one that you would use in an enema for detoxification. Yes, you heard me correctly, an enema. And I can give you that whole story, in a different program, or you can give me a call and I'll let you know about that as well. But the point of it is that coffee has some significant side effects based on your health. I have patients who've come in and have had serious structural problems, inflammatory reactions to their joints and their back and their neck and so forth. And we've tested them and we found them not allergic to, but sensitive to, and that means the liver can't handle the detoxification process of coffee. You get them off of the coffee and they feel a whole lot better and their therapies begin to hold and take effect. Now, I know I'm throwing the water on the fire for so many of you, but here's the deal. If you're looking for the effects, the positive effects of drinking a cup of coffee, you can get those by drinking a cup of green tea. And it's going to have much greater beneficial effect on the entire system. It's a tremendous antioxidant. The polyphenols are really high, and you're going to decrease your risk of many different types of cancers, and you're going to protect your body generally. Ladies, you're going to protect yourself against breast cancer. Guys, you're going to protect yourself against prostate cancer. So if you're going to drink a cup of coffee, make sure it's something like Kona, and it's 100% organic, so you don't have all the garbage that's induced in it. But you're going to go through and you're going to look and you find articles from the New England Journal of Medicine, who I think of all the medical journals out there, I think quite highly of in most of their situations. Obviously, I have their, some of their things in disagreement. However, even today with the Journal of Alzheimer's disease, there's things out there that are purporting the benefits of coffee. However, take a look at your own health pattern. Take a look at your own risk levels. Is your liver working the way it's supposed to? When you drink coffee, it may wake you up in the morning, but does it give you afterwards a feeling of just uneasiness? It causes your stomach to bloat. You hurt in different ways. You have chronic pain that you can't get rid of. Remember, coffee is also very dehydrating. So when you're drinking coffee, you have to drink water, and lots of it. So is the news all bad? Is the news all good? No. Trust me, I'm Italian. I grew up with coffee in the house, and there's nothing I like better than the smell of espresso. But I can't do it because it causes my joint spaces to go crazy. Many of you are in the same boat, and you would not do very well if you continued the process. So be very careful. I'll be more than happy to answer other questions. You can get a hold of me at Roselle Care. I do answer all of my mails sooner or later. Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. Been broadcasting you to from 105.9 FM, right here as I do every Sunday at 12 noon. Call me at 888-630-WMAL any Sunday, and when it's not Sunday, you can go to rosellecare.com and get a hold of me, and we'll send you whatever feedback we need to. And again, I want to encourage you, October the 20th, a day you will not forget. I promise you it's worth your time. I promise you you're going to go home with more information that you ever thought was possible, that you're going to understand how to handle your life relative to the foods that you eat, how your body reacts neurologically, how your hormones work. You're going to learn about the body-mind connection, but more importantly, you're going to be able to apply it. RoselleCare.com. Go online, register today, and remember, we're filling up very, very quickly. A couple of patients asked me recently about shingles, and the name for shingles is herpes zoster. And, shingles is a viral infection, and it's the same virus that causes chickenpox. So after you've had chickenpox, the virus becomes dormant, in your nervous system, but it can be reactivated years later, and as an adult, it's called shingles, right? So it's very common, generally, between people who are 60 and 80 years of age, and the reason for it is that your immune system begins to weaken. And so subsequently, with a weakened immune system, anything can flare up again. And that's why as we get older, sometimes we haven't taken care of ourselves the way we should, and we get sicker. And, again, going back to, is your body acid, is your body alkaline, are you sleeping properly, are you stressing too much, and so forth. So the pain, the burning, the numbness, the itching, the horrible rash that's filled up with, fluid, all these things. You can get fever with it, you can get chills, you can get headaches, your body can hurt all the way through. It usually runs along a nerve root, like from one part of your spinal cord, and you can trace it. It's like an exact line. Sometimes, unfortunately, it happens and ends up causing scar tissue. Now, what can be done about it? Well, there's a lot that can be done about it. And here's what I want you to understand. Two things. First thing is the shingle virus is there in your body like most viruses that you've ever been exposed to. It's just only when your immune system is weakened do you have the manifestation of the symptoms that result because of that virus. But if you notice, there's a big push now to inoculate everybody with the shingles vaccine. Well, they're inoculating you with an attenuated virus. They're giving you the shingles virus at a very low dose, thinking that your immune system is going to perk up and handle it. Well, here's the deal. If you've got a lousy immune system to begin with, and that's causing the reactivation of the underlying virus, what do you think is going to happen when they give you the inoculation? It doesn't work. You just end up with a greater potential, in my opinion, of getting shingles anyway. So what can you do about it? Well, there's a lot of things that you can do if you have it. First, to prevent it, you want to get your immune system up, but we could talk about that all day long. There's something called proteolytic enzymes, and these are enzymes that are produced naturally, but they help the pancreas to break down proteins that we eat and other food substances and so forth. These proteolytic enzymes are found in things like papaya and pineapple, and they're called papain and bromelain. There's many others, amylases and proteases and so forth. You can get them at health food stores, and they will help, but you have to take them in high dosages. And if you're taking it for the shingles, you've got to take it on an empty stomach, because if you don't, then it acts as a digestive enzyme. So proteolytic enzymes work. High levels of vitamin C, because vitamin C is a natural antiviral. And then B12, but high dosages of B12. Now, in our practice, we give mega doses of B12, but it has to be combined with folic acid, and I would not suggest that you do that unless you're doing it with somebody that knows their stuff, like our practice. There's a cream that you can get. It's a combination of calendula, Calendula, and Capsaicin cream, and that's spelled Capsaicin, and it's actually pronounced capsaicin, and these things, it burns, but it has a very excellent effect for the pain of the shingle onset. It can be used as a cream or an ointment, works very, very well, but zinc and all those things that we talked about will help, but you have to use them at an extremely high dosage. Wish we had more time to talk about it, but it's very preventable. Got to get your immune system up. How do you get your immune system up? Structural, chemical, emotional diligence all the time. We're here every Sunday bringing you the most informative information that we can, things that are out there, things you need to consider for you and your family. See you next week, 12 o'clock. This is Dr. Tom Roselle. Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com. Did you know that maintaining a total state of wellness is a choice? That you have total and absolute control over anything that happens to your health and wellness? This is Dr. Tom Roselle, author of Ageless Health 101, Health is a Do-It-Yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. A state of total wellness is your choice. You have the capacity to change your health and level of well-being. Take control of your health. Are you looking for great tennis instruction in a dynamic, challenging, and fun environment? Hi, this is Dr. Tom Roselle, inviting you to visit rjtennis.com to learn about the most popular adult tennis program in the metro area. RJ Tennis programs are packed full of energy and non-stop tennis. With exhilarating drills and games, RJ Tennis will energize your game, fitness, and life. So call a friend and sign up today at rjtennis.com. That's rjtennis.com.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.